learning skills and how this is looking for the next 10 years. So in order for us to understand a skill, we need to know how to measure a skill and how to assess it. This is a conceptual model called the Miller's Pyramid, where it has 4 levels. And at the beginning, we traditionally learn from, and we can assess the traditional knowledge by just applying regular classic tests. So for instance, if you want to know if a surgeon knows how to perform an appendectomy, it is not only important to assess if the knowledge is okay, but also if the skills are there. So will this surgeon be able to perform and treat the appendicitis? And it's not so easy, because usually, as even if people don't know, in countries, when surgeons are recertifying their titles, when they are achieving and accrediting that they are general surgeons, they don't get practical skills tests. What they get is a knowledge test. So this is something that needs to change in the future. So we will cover these 4 levels that are very interesting and very important. The 4th level is the easiest to remember, but very difficult to acquire, and is the real practice. When you are, for instance, as a surgeon, I'm treating a real patient. If I'm teaching you guitar lessons, the 4th level is concert, the real deal, the real scenario. The 1st level, though, is knowledge. And before we actually practice a concert, we need to understand how musical scales work, how to play the guitar as a concept. Then you will have some tests that will try if we can compose music or not. In surgery, it happens the same thing, or in nursing, or in any discipline that has practical skills. So the important here is that we need to be able to measure every level of performance. So the 2nd level, the know-how, usually, as an example, we can ask a trainee to be able to, how will this trainee respond to an actual clinical case in a virtual scenario. So for instance, we can incorporate virtual scenarios and see if a trainee will be able to perform well in theory. If they are able to do, for instance, how to take a blood sample, if it's a nursing type of exercise. And we will understand if they know what the protocol is, how to do a sterile procedure. But if we want to understand if the practical skill works, so for instance, if they know how to manipulate the needle, how to cross the tissue, how to take the sample, then you will need a simulated scenario. And usually the virtual reality simulated scenarios are not enough. You need to transfer the skills from a virtual reality scenario to an actual hardware that permits and allows to have haptic feedback and let you, we're heading there, but we're not yet there. We are soon to get this into these virtual scenarios that will be able to train us very good in skills. Another example that I always say is if you're playing FIFA, PlayStation, soccer, this doesn't mean that you are a good soccer player. What it only means that you have learned the rules of soccer and how to use a joystick. So in order for me to teach you soccer is a very nice application, and we would be moving in the level 1 and level 2 of this Miller's Pyramid. But we will still need to have this 3rd level assessed in a real football field so that the trainee shows me that they are acquiring the actual skill. So it doesn't happen that often, especially in the healthcare area. And the real scenario would be a game of soccer. So an actual game of soccer, and to see the performance of the trainees. So how do we transfer skills? It's not that easy, because it's not like you can watch a webinar and then you have the skill. You need to practice, and you not only need to practice, you need to have good quality practice. What is good quality practice? It's to repeat in time a session where you're actually performing the procedure and receiving feedback on how to demonstrate this, how to improve the skill while you are doing the practice. So in short term, in short sense, it means that you practice with effective feedback. So someone is telling you where your mistakes happen, and what once you do this type of mistake, how to improve this mistake, and that's good quality practice. So we need some at least these three pillars in order for us to transfer skills. The first pillar is the space and infrastructure. We need a place where we can actually train. So in the example of a guitar, we need a guitar. If you're going to learn music, you need a guitar, and you will, if you want to learn soccer, you will need a ball or a field, and you will need some hardware. Depending, let's say in the guitar example that I want to teach you advanced guitar, you will need maybe a closed room, you will need a microphone, you will need a streaming system to record yourself. That's all the pillar one. You also need a second pillar called the training program. What are you going to do in every session? What is the objectives? What is the instructional design for this course to happen so that you can actually learn the skills and decrease the learning score? So this is very interesting because usually training programs are not that valid. What I mean with validated is that the program tells, if a program is telling you, you are going to finish with advanced skills of guitar, you actually end up with those skills. If you end up with basic guitar skills, then the program is not that valid. In simple terms, if the program can predict that you will do in the fourth level of the Miller's pyramid, you will perform good in this level, then the program is valid. If the program trains you and it's not enough for you to perform good in the fourth level, then we're having a problem. So, and as I was telling you, to have good quality practice means to not only repeat, but repeat with feedback. So the third pillar has to do with who is giving this feedback, who is giving this type of feedback, and how will you incorporate feedback so that your performance